think this is an area that we are still learning a lot about. And so it has to do with the stability of the joints. The general rule of thumb is the stability of the joints after surgery is the same or similar to what it was before surgery. And so if your joints give you trouble, they hurt, you can't open your mouth, there's a lot of mechanical symptoms like locking or catching, it's most likely that those will continue after surgery. That's not every situation and it's not every surgery, but just generic double jaw surgery, Lefort BSSO. If your joints look bad on x-ray but they function well, there's good philosophy of leaving the joints alone and just doing jaw surgery. The thing that we've been learning over time though is there are people who experience condylar resorption after surgery, and that they go through an operation to correct, let's say, a skeletal class 2 or a small lower jaw, and go through the whole recovery, finish up braces, and then the lower jaw starts drifting back because of condylar resorption. I think the people who are at most risk for that's still a little bit unclear, but it's a discussion that I have frequently with people, whether we risk the possibility of relapse after surgery by not treating the joints in cases of severe arthritis, or we do joint replacement and a Lefort to move the lower jaw. So the lower jaw can be moved with joint replacement to take away the risk of resorption of the condyles after surgery. So that treats the joints themselves rather than the lower jaw extending out. So it treats the joint and it pushes the jaw out rather than doing surgery in the middle of the jawline to bring it out. So those tend to be the two options, and I find both options are good. I think it's just weighing risks and benefits of the operation.